an independent review. Yet the review also found that contracts signed by the government for vaccines against the H1N1 virus were set in concrete, meaning Britain was left with 20 million flu shots it didn't need. Here's our science editor, Susan Watts.
Last spring, the world thought it was facing the deadly flu pandemic health authorities had feared for decades. A new flu virus was spreading fast, but just how dangerous it might prove to be was not yet clear.
Flu viruses can spread if you don't catch your coughs or sneezes hygienically.
Yet in the midst of that uncertainty, governments and health officials everywhere had to decide how to respond. Dame Deirdre Hine, a former Chief Medical Officer for Wales, was asked to look at how the UK coped. Her report, like the pandemic itself, turned out to be pretty mild. She does not think we overreacted.
I would take you back to this time last year when it was quite scary actually for the government as to what was happening. We knew that there was a pandemic brewing, that in fact there were some very apparently severe cases in Mexico, and that they were coming with very surprising rapidity to this country.
She concludes that how ministers and officials handle and convey uncertainty is a key lesson for next time. The difficulty, Dame Deirdre concludes, was that ministers and officials were quoting numbers for possible cases and possible deaths that represented a reasonable worst case. But they should have made crystal clear that though these figures were planning assumptions, they didn't represent the most likely outcome. It's the headline number that tends to be remembered, not the caveat.
Cases are doubling every week, and on this trend we could see over 100,000 cases per day by the end of August, though I stress this is only a projection.
Then there was the Chief Medical Officer for England, Liam Donaldson, who said his plan was to prepare for the worst and hope for the best. But the review suggests he had another option, to prepare for the most likely. At one point, he referred to the number of possible deaths as 65,000. But again, Dame Deirdre thought the context could have been clearer.
What we recommend is that alongside that, they calculate the most likely, not just the worst case scenario, but the most likely. And these predictions, these calculations were made. They weren't used as regularly publicly as the planning assumptions.
She also highlighted frustration among scientists advising government. One told her they felt they were being asked to be court astrologers. Peter Openshaw was on the government advisory team. He says there was pressure for answers, and that only better surveillance through simple blood tests would have helped to establish earlier on how severe the pandemic was likely to be.
That information would allow us to estimate how many people had mild disease, because we know a lot of people had very mild or inapparent disease, and how many people actually had severe disease and then would need hospital admission, and a lot of them would need intensive care. That was absolutely vital information from an early stage.
But perhaps the most controversial aspect of the pandemic was the vaccine contracts. Dame Deirdre said advanced orders were useful, but the government ended up trying to negotiate break clauses late on, and now has 20 million unused vaccine doses.
The lack of a break clause in the contract is a real problem, and I think that increasingly governments are going to need to strike much more hard-headed deals with the pharmaceutical industry to share the risk in positions of such uncertainty, when we really don't know at the beginning whether this was going to be a mild or severe outbreak.
Mike Grannett is a former head of Britain's Civil Contingencies Secretariat. He says a more sophisticated approach is needed.
When you're dealing with something like flu, about which the only certain thing is the uncertainty of what's going to happen, you need to be able to talk to people in probabilities, a range of risks, and to get them to understand that although you might be preparing for the worst, you need to think about different levels of problem, and for people not to lose trust, for example, because they don't see the worst happening. Now, we live, sadly, in a sort of black and white society. We see headlines in black and white, we expect answers in black and white. And I think there's a real problem there that ministers and officials have to deal with, which is to educate people in the grammar of uncertainty.
Though mild for most people, 457 died from swine flu in the UK, with pregnant women and young children often worst affected. The next pandemic could again prove mild or perhaps more severe. Either way, the challenge will be convincing people to take government warnings seriously.
Susan Watts. Andy Burnham was Health Secretary at the time of the swine flu outbreak, and he joins me now. Mr Burnham, did you get things wrong?
No. Dame Deirdre's conclusion in her report today was that overall our response was highly satisfactory. And of course there will always be lessons to learn from any major pandemic of this kind, and that was precisely why, together with colleagues in Scotland, Wales and Northern Ireland, we commissioned Dame Deirdre to produce this report. So I'm sure the government will study its conclusions carefully, but overall the response was good.
Indeed, and she accepted that, but there were a couple of points, as we raised in the report, which were quite important. I mean, this question of how to handle risk and convey uncertainty. When you told the Commons, based on the information you were given, that one projection was 100,000 cases a day by August 2009, that tended to be reported as a scare story.
Yes, I mean, this is a fair point, and I often found myself in a difficult position last year. As Dame Deirdre said, this time last year was a very scary time because cases were climbing fast, and it was unprecedented territory to have such a spike of flu cases in the middle of a British summer. So I was faced with a situation where I was being given projections, a reasonable worst-case scenario, as was said. And in a freedom of information age, I think it's only right that ministers communicated to the public the advice that I was receiving from experts. So
But that was very unlikely, wasn't it? I mean, I know you're absolutely right. This was called a reasonable worst-case scenario, but to most of us, that sounds like it's something that's quite likely to happen, whereas, in fact, reasonable worst-case meant it wasn't very likely to happen.
Well, the figure I quoted of 100,000 cases a day, I mean, in the middle of July last year, we did get up to well over 100,000 cases in the week. So we were well on the way, and obviously at that time,
in a week rather than a day,
sorry?
But in a week rather than a day, and that coupled with what Liam Donaldson said about it could be 65,000 deaths.
Yes,
I mean,
but
obviously
Gavin,
there were too many.
The most important thing here is, of course, better to over-prepare rather than under-prepare. So the fact of me saying that did also then say to the system that we really need to be prepared for the worst. And I think that is the job of any minister, any responsible minister. I was there to protect the public. Sadly, 457 people died, and I think of them and their families today. It's going to be difficult for them to see swine flu back in the news, but because of the action that we took, because we were able to deliver a vaccine very speedily, I think we minimised the death and disease, and that overall is the responsibility of any minister.
And the report said you did do that, you did deliver the vaccine quickly, but it also said, as you well know, this question of break clauses seemed to work in the benefit of the pharmaceutical companies who produced it, but didn't work to the benefit of the taxpayer. In other words, you should have been tougher on the pharmaceutical companies.
Well, let's just remember what the government did. We had two contracts, two advance contracts with the pharmaceutical companies, and rightly, because we couldn't have all of our eggs in one basket, so we needed to have those two options. Now, one of those options failed. It did not deliver the vaccine that we needed, so thank God we had another option. Now, that company, in common with all major countries around the world, said that it didn't want a break clause because of its certainty of its production capacity. But because of that, because we struck that deal, it put Britain at the very front of the queue internationally for vaccine. Now, I don't regret that decision at all.
So I can
say to you, Gavin, sitting where I was this time last year, I was very pleased indeed that we had those contracts in place.
So it was worth the money, even though we're ending up with 20 million vaccines that we're not going to use.
That's not me saying that. That is Dame Deirdre's conclusion. She says in respect of the vaccination policy that it was soundly based and it produced value for money, because she then says, relatively, the low cost of vaccine compared to lives saved. So there are lessons to learn, and I think we rightly now will digest the findings of this report. That's why I commissioned it. But overall, we took a proportionate set of decisions that took the country through the problem, and I believe we minimised suffering and deaths.
Mr Burnham, thanks very much.
Thank you.